This is Dr. Michael Cameron, and this is the Registered Behavior Technician Module 10. This specific module represents a major milestone and a whole host of accomplishments. From a milestone standpoint, this concludes Section B, which is devoted to assessment. So to date, you've learned about reinforcer assessment, you've learned about preference assessment, you've learned about skills assessment. We've talked about a variety of different tools that you may be involved in using, such as norm referenced assessments and criterion referenced assessments as well. Today we'll be talking about functional behavior assessment. And the reason this component is so critical and so relevant is because we need to understand what the obstacles are to a person's learning. We need to understand what interferes in terms of their learning process, and we need to understand what the causes are of the behaviors that interfere with their development. So the FBA process and the functional analysis process are just critically important. This also represents the completion to date of two entire sections. The first one is Section F, which is in your scope of practice and professional conduct. So you've learned about why you do what you do, and the relevance of supporting individuals and with a variety of different presentations and a variety of different ages as well. You've learned about your ethics and your ethical responsibilities. You've learned about the importance of communicating with stakeholders and keeping everybody informed and involved. You've learned about the relevance of the data collection that you'll be doing, the importance of it, and how decisions are made based on the data that you collect and present to other individuals. So to date, we've got completion of Section F, the scope of practice and your professional conduct, and then this represents completion of Section B, which is all about assessment. And assessment is where it all begins in the field of behavior analysis. It is where everything begins with respect to doing our work and supporting another individual. So it's logical that we've reviewed the assessment section first in terms of the training. Now, with respect to the details, this is strand B04 in the assessment category, and the title is Assist with Functional Assessment Procedures. The duration of this module will be 60 minutes, and there'll be a competency-based quiz at the end, 5 questions as usual. Now, you'll notice that one of the things I've been doing in this training is to make recommendations to you regarding skills, knowledge, and abilities that you need to demonstrate. So at the conclusion of this module, what I would suggest to you is that you ask your BCBA supervisor to show you a completed functional behavior assessment, one that they've done, and a protocol and a model that they use. Everybody here will be working in a different capacity. There'll be some people here going through the training that will be working in a school system. Could be a private school, could be a public school. There are other people here that will be doing home-based services. So perhaps the majority of your time will be spent in families' homes, supporting individuals during after-school hours or on weekends or in evenings, for example. Other people here will work in clinics. You may be working in a clinic with an interdisciplinary team. Other folks may be working in a hospital setting where services are delivered in that context. So the point here is that the clinicians that you work with will have very specific tools that they use in order to conduct a functional behavior assessment or a functional analysis. And it'd be really good for you to familiarize yourself with that tool prior to having to use it. So in consequence, once you've reviewed the tool, it'll be very beneficial to rehearse actually using the FBA tool that you'll ultimately be responsible for assisting with, and then finally demonstrating your ability to support the entire FBA process in the context of an interdisciplinary team. Now, with respect to my specific goals for this module, one of the first things I want to do is to give you a brief review of the history of functional assessment. I always like to ensure that people are anchored with respect to people in the field that have made very important contributions in terms of the science. So for that reason, I always like to review history a little bit, just to make sure that you have good familiarity with who in this field has been responsible for making the major contributions that we benefit from as clinicians today. I benefit from as a board certified behavior analyst. You will benefit from as a registered behavior technician. My other goal for this module is to review the 3 types of assessments that you'll use and be part of using, and the assessment process that you'll go through as well. My third goal is to discuss the implications of the findings of a functional assessment. I'll give you a bit of a preview here. We conduct the FBA process, the functional behavior assessment process, because we're trying to uncover the causes and the function of aberrant behavior, maladaptive behavior. Why? We're doing that in order to develop a behavior intervention plan or a behavior support plan for an individual. And it is supremely important that any plan that we develop for an individual is linked to assessment findings. So we've got to have an understanding of why a behavior is occurring before we go into the business of actually intervening, because we want to make sure that the intervention that we design, that we plan, is related to the reasons the behavior is occurring. So I'll be spending time on the functional behavior assessment process, but also as it leads to the behavior intervention plan. And as a result, I'll be reviewing what the critical elements are of the behavior intervention plan. And then finally, I'll be discussing your role as a registered behavior technician during the entire FBA process. Now, with respect to history, I want to remind you that B.F. Skinner made very important contributions to the field of behavior analysis. And Skinner, as you recall, is a basic researcher. He worked with animals, he worked with rats, he worked with pigeons, and his interest was in identifying the variables that were responsible for accelerating behavior or decelerating behavior. And he made major contributions to the field of behavioral science as a result of his research. Now, Skinner was also the first person to use the term cause of behavior or refer to cause. He was also the first one to talk about the function of behavior. Skinner had a very deep appreciation for very precise language, and he really admired individuals from other fields of study, such as mathematics and physics, for example. He admired the precise language that those individuals used. So he brought that same standard to his field of experimental analysis of behavior and used very precise language. And he underscored the word cause and the word function because he demonstrated through his own research that behavior was functionally related to the consequences that followed the behavior. And he demonstrated that over and over again. And he showed us the impact of positive reinforcement, the addition of something following a behavior that accelerates behavior. He showed us the impact of negative reinforcement, the deletion of something or the taking away of something that also accelerates behavior. And he showed that through his basic research and his research findings. But he was the first one to begin talking about causes and function of behavior as it related to the environment. Subsequently, it was Dr. Brian Iwata from the University of Florida, who in the late 1970s and the 1980s began studying the self-injurious behavior of people with developmental disabilities. He was interested in this. So Dr. Iwata was taking this into the applied field. So Skinner, once again, is a basic researcher, worked with animals, worked with pigeons, worked with laboratory rats. Dr. Brian Iwata was very interested in translating that research and those research findings into the applied world. He wanted to work with individuals who were exhibiting severe forms of self-injurious behavior, and he wanted to develop a protocol that would allow us to make a determination as to why that behavior occurred. What behavior? The self-injurious behavior. Why would you want to do that? Because in identifying the consequences that may be accelerating the behavior or maintaining the behavior, and identifying the antecedents that appear to trigger the behavior, we could then be in the business of altering the environment and then ultimately alter the individual's behavior through a really good behavior support plan. So that was Dr. Brian Iwata's contribution. Very important contribution. He was the first one to establish that protocol, to map that protocol for us, and to give us procedural guidelines to walk us through that process of doing an analysis of aberrant behavior or maladaptive behavior. So two very important people in our field, Dr. B.F. Skinner, Dr. Brian Iwata from the University of Florida. So Iwata emphasized the function of behavior and the reasons why the behavior occurred, self-injurious behavior, and rather than the form. So it wasn't so much what that behavior appeared to look like in terms of the topography of the self-injury, whether it be a strike to the head with a fist, for example, or whether it be head banging. It wasn't so much the topography that was relevant, but the function of the behavior that is highly relevant. So he gave us the protocol for actually examining the reasons why behavior occurs. So the functional behavior assessment process, since Iwata's contributions, has been refined and forms a substantial literature base in our field at this juncture. One of the things that I've mentioned during previous training in terms of your responsibilities as a registered behavior technician is to keep abreast of the literature, to keep on top of the literature, and to ensure that you're constantly educating yourself. And one good place to go would be to the Journal of Applied Behavior Analysis, for example, to begin looking at some of the research findings as a result of conducting a functional behavior assessment, and familiarize yourself with those research articles. The other thing I want to mention is that the process of functional assessment, now that it is so well developed at this juncture, it has been used for multiple populations. So although the work by Dr. Brian Iwata was with individuals with developmental disabilities, FBAs, the entire assessment process, is also used today with typically developing individuals as well, adults as well as adolescents and children. One great example of this is an article entitled "A Naturalistic Functional Analysis of Binge Eating." So Johnson and colleagues were very interested in binge eating disorder among typically developing individuals, and used the functional assessment process to make a determination as to why that eating disorder was occurring. So you can see that as a result of the groundbreaking work by Skinner, the groundbreaking work by Dr. Brian Iwata, we now benefit as a result of being able to extend these findings and these protocols to more diverse populations. So quite simply, what is a functional behavior assessment? Well, it's a set of procedures for identifying the causes of challenging behavior and the variables that maintain the behavior. That's what a functional behavior assessment is. It's critically important, as I mentioned, that we understand what the causes of behavior are. Why do we want to do that? Well, first we want to identify a functional relation between challenge and behavior and environmental variables. The reason that that's important because when we identify the environmental variables that are responsible for maintaining or accelerating a problem, we are then in a position to adjust those variables. So it's our understanding of the function of behavior that allows us to effectively support the process of change. As a result of understanding the function of behavior, we can then develop a behavior intervention plan. So the information that we acquire through the functional assessment process lets us design the very specific individualized intervention for the person that we're supporting. And just one note, one of the things that I want to mention is that, throughout this presentation, and I'm sure through other presentations that you've heard, we often talk about problem behavior or challenging behavior. One of the things that I like to point out is that through our lens and through our perspective, the behavior that we're seeing, viewing, witnessing, observing may be a problem for us, but quite frankly, it's a solution for another person. The person exhibiting the behavior, that behavior is a solution. As a result of that behavior, they get things that they want, or they avoid things that they don't want, or they escape from circumstances that they don't want to be in, or they're receiving some kind of automatic reinforcement as a result of the behavior. So we view it as a problem. We view it as a challenge. We call it aberrant. We call it maladaptive. But for the individual that's exhibiting the behavior, it may be a solution. It may have unfortunate outcomes, and it may complicate their lives in a relevant way, but it is a solution for them. So just a way of taking perspective that I think is really important. Now, we keep talking about function of behavior and causes, and one of the things I want to do at this juncture is to review those things that we know are responsible for maintaining behavior. And the first is what's referred to as socially mediated positive reinforcement. All that means is that the consequence that follows a behavior is arranged by another person. So that's why we call it socially mediated. So it's coordinated by, arranged by another individual. And then, as you know from your good definition and from your learning prior, we know that positive reinforcement means an addition or the adding of something. So a behavior occurs and somebody, so it's socially mediated, adds something that ends up escalating or accelerating the behavior that occurred. So what kinds of things could be added? Well, you can add attention to a person following a behavior. You can give them access to activities. You can give them access to tangibles as a result of a behavior. And when that occurs, when those consequences follow, and it's socially mediated, socially arranged, that can end up accelerating, increasing a behavior, and that behavior may be one of concern. So as a result of the addition of attention, and it could be physical attention, it could be verbal attention, it could be nonverbal attention, and it could be something as simple as eye contact. So various forms of attention, physical attention, verbal attention, nonverbal attention, can all result in the escalation of behavior when made contingent on the occurrence of behavior. Once again, socially mediated, positive reinforcement, meaning the addition of something. So when doing a functional behavior assessment, one of the things that we're interested in is in examining whether socially mediated positive reinforcers may be contributing to the occurrence of a behavior. The other factor that may contribute is what's referred to as socially mediated negative reinforcement. So once again, from your definition, which you've learned before, negative reinforcement is a removal of something. It's a withdrawal. It's a subtraction of something. And that something is typically something uncomfortable or aversive to the individual. So socially mediated, meaning somebody else coordinated this, somebody else arranged it. So following the occurrence of a behavior, another individual removes something that may have been aversive. So in that regard, the person exhibiting the behavior was able to escape. Or if they did it proactively, they were able to avoid something that was unpleasant or undesirable. Oftentimes we talk about demand situations and a person being motivated to escape a demand or to completely avoid a demand or to postpone a demand. So that's another variable that we'll look at. So far we got socially mediated positive reinforcement and then socially mediated negative reinforcement. Another category is what's referred to as automatic positive reinforcement. And that means that the movements or activities of the body that result in sensations that are desired. So here we have the addition of something. However, keep in mind that automatically, that the term automatic means that another person's not involved. This is not socially mediated. So this comes with automaticity. This comes automatically. This comes as a result of the person being in control of the behavior themselves. And it results in an escalation in behavior when a person engages in something, and the consequences are automatic, and the consequences may indeed be reinforcing to the individual. Now, with respect to other causes of behavior, I will, in another module, be talking about the respondent paradigm and respondent conditioning. However, here, for the purpose of this module, we are talking about operant conditioning. So, just by way of clarification, who conducts a functional assessment? It'll be a board-certified behavior analyst that will do it. It could be a school psychologist. Once again, one of the things that I mentioned to you is that many people here work in the context of a school system. So it might be a school psychologist that's conducting the FBA. Or it actually could be a teacher that's responsible for a classroom. That may be a special educator, for example. It may be a general educator. But that person, if they have the skills and abilities, may actually conduct the functional behavior assessment process. Also, if you're working in a school or a hospital-based setting or a clinic-based setting, oftentimes it's a functional behavior assessment team that coordinates this process. Everybody will take on a certain role or a certain scope of responsibility, and they will go through the entire process as a team. And one of the things I want to underscore here with respect to the FBA process is that you're always involving the family or the guardians. They have very important things to say. They have very important insights and observations, and they are part of the team. So whenever I talk about team, I know I keep making reference to speech and language pathologists or occupational therapists or physical therapists or teachers, special educators, and general educators. However, I want to put the bright light on the family, and the family is always part of the process and part of the team as well. With respect to the desired outcomes of an FBA, well, we want an understanding of the function of behavior. What does the person get as a result of engaging in the behavior? So are they getting socially mediated positive reinforcers? Are they getting socially mediated negative reinforcers? Are they getting automatic reinforcement? So it's only through the FBA process that we're able to make the determination as to what the individual is getting. And then as a result, we also gather an understanding of what the person may be trying to communicate via their challenge and behavior. Now, keep in mind, for those of you here working with individuals with autism spectrum disorder, for example, a good proportion of the individuals that you work with may be minimally verbal or completely nonverbal. So as a result of their compromised ability to communicate, these individuals may use aberrant behavior, problem behavior, in order to get what they need and get what they want in the world. Again, it's a solution to a problem. They can't communicate. They have no other way of getting through to individuals what it is that they want or need. So therefore, they resort and default to aberrant behavior, problem behavior for the purpose of communication. So one of the things you'll learn through this process is that communication training, whether it requires assistive technology or picture-based communication or vocal verbal communication, is going to play an important role, very important role with respect to the design of a person's plan. The other thing that we want out of the FBA process is that we want an understanding of a person's strengths. So I've mentioned this many times already throughout the entire training. Through our work with individuals and through our evaluation of individuals, we not only want to know about their deficits or where they're falling short with respect to skills, knowledge, and abilities, we also want to know what their strengths are, because it's building upon strengths that really allows us to bring a person along in a dignified way, in a very respectful way, and in a very helpful way. And having said that, of course, we also want to understand a person's skill deficits and performance deficits. Skill deficit meaning that the person has an absence of a skill repertoire. There's something that is not there that needs to be there. A performance deficit is something that is intact. However, the person is just not performing it, may not have the motivation to perform it. So we want to know that. as a result of the FBA process. What are the skill deficits? What are the performance deficits? And then finally, we want information that will allow us to develop the behavior intervention plan. I mentioned this already at the beginning of the module, that this is where all this is going. We want to understand the causes of behavior, the function of behavior. Why? Because we want to develop a behavior intervention plan, a behavior support plan. Why would we want to do that? Because we're trying to improve the person's quality of life. We're trying to take care of the obstacles that are getting in their way of learning, and to correct those things, and to ensure that that person has a quality of life that is good and healthy. That is what we're trying to accomplish. So through the FBA, we're trying to understand function. We're trying to get an understanding of what the person is trying to communicate through their behavior. We're getting an understanding of their strengths. We're getting an understanding of skill deficits and performance deficits, and all that so we can develop the behavior intervention plan for the person. So with respect to functional behavior assessments, there are going to be three forms that you'll use, and they fall along a continuum of precision and a continuum of level of difficulty. And one of the things I want to underscore here is that your board certified behavior analyst supervisor, or the team that you're working with, will make the determination as to the best course of action with respect to the functional assessment process. But the three methods and the three types of assessment that you'll do are as follows. First, there's what's referred to as an indirect assessment, and I'll explain that in a moment. The second is what's referred to as a direct observation and assessment in the natural environment. So the natural environment could be the classroom, it could be the home, it could be the community. So in this case, you're actually doing a direct observation of the individual. And the third form of evaluation is what's referred to as experimental manipulations. This means that you're actually manipulating the consequences. You're doing something in the environment, you're changing things in the environment in order to deliberately escalate the problem behavior, just so you can demonstrate the actual function of that behavior. So when you get to experimental manipulations, you are actively doing something in the environment, you are changing consequences, you are deliberately arranging consequences, all for the purpose of trying to understand why the behavior is occurring. So we don't do it in an effort to exacerbate a problem. We don't do it in an effort to make an individual worse. Of course, we're arranging consequences deliberately. Those consequences that we think that are maintaining the behavior or accelerating behavior, all because we want to verify that those are the variables responsible. So three types of assessment: indirect assessment, and then direct observation and assessment in the natural environment, and then experimental manipulation. So those are the three forms of assessments that we'll be discussing. The first one is indirect assessment. And one of the things that I mentioned a little bit earlier is that your board certified behavior analysts will have specific tools that they use. And I'm going to give you an example of one of the tools just to give you some familiarity with the tool. The particular tool that I'll discuss is the functional assessment and program development for problem behavior. This is a tool that I've used through a good part of my career, and I find it extremely helpful. Now, one of the things I want to mention, because I want to make a linkage here back to the ethics training, one of the things that we're always cautious about is that when we're doing assessments, you will want to ensure with your team and with your board certified behavior analyst supervisor that there's consent for doing this. So I put the bright light over here on consent. You're looking for the family to agree that the assessment will occur, and you're getting their explicit permission for conducting the assessment. Now, your board certified behavior analyst or the school system that you're working for, maybe it's a school psychologist, for example, who's conducting the FBA, will have their own consent forms that they will have signed by a parent. So your expectation is that the parent will receive a good overview of why an assessment is being done, why the functional behavior assessment is being done, what the results are, and what we're hoping for with respect to outcomes, and providing a rationale in terms of why an FBA is conducted, and then go about the process of receiving consent from the family to actually conduct the process. So once again, this is an indirect assessment, and one of the things that you'll see here is that this particular assessment is called the Student Guided Functional Assessment Interview. So you are essentially, when going through this process, you're interviewing the individual that is engaging in the challenge of behavior. And of course, this is all predicated on the assumption that the individual has good vocal verbal abilities, good communication skills. Obviously, if the person is more compromised with respect to their communication capabilities, this is not a tool that you would be using. But by way of example, this is one of the tools that can be used for the purpose of interviewing an individual. So this is an indirect assessment because it's not deliberately manipulating consequences in the environment. We are gathering information in the context of this assessment. So as you can see here, the individual is being asked questions. What are the things you do to get you in trouble or are a problem? So you could mention to the individual, perhaps it's as a result of being late to class, maybe it's talking out in class, talking out of turn, not doing your work, or having some kind of altercation with another individual. So as a result of that, the behaviors that do cause problems for the individual are delineated, and then the comments are documented in terms of what the person says about it. And then the next question would be, which of the behaviors described are likely to occur together in some way? Do they occur about the same time, in some kind of predictable sequence or chain? So for a person, for example, a person may respond that they begin some kind of verbal altercation with another individual, and then that may give rise to some kind of physical interaction with the individual. But this is a student-guided functional assessment interview, and the same thing could be done with families. For example, you may ask them a series of questions in order to get a sense in terms of what may be causing behavior or what function a behavior may serve. Here's another example. This is a student schedule and routine matrix. And essentially telling the person that you know that there are some times during the day or activities that occur during the day that are harder or easier for people. And the question becomes, can you tell me which times during the day are easy for you and what times are difficult for you? So what they're offering here is a rating scale. It's a Likert scale. And the 6 indicates that it's likely the person will have a problem. And then the 1 indicates that there's typically not a problem or very few problems associated. So for example, the individual may list math class, or they may list language arts, and indicate the level of difficulty or whether that particular scheduled activity, the class activity, is one that gives rise to difficulties. Why are we doing this? Well, we're doing this so we can get a sense in terms of what the variables are, the environmental variables that are giving rise to problem behavior. So this is what's referred to as an indirect assessment, and this is one tool that can be used for the purpose of conducting an indirect assessment. These assessment tools are used for students. For example, they can be used to interview a family. They can be used to interview a teacher. There's a variety that are available. That's why I'm going to remind you once again, speak to your board certified behavioral analyst to make a determination as to what tool they're using for the purpose of conducting an indirect assessment. Another option is what's referred to as a rating scale or a checklist. So one great example of a rating scale is what's referred to as the motivation assessment scale. And this was developed by Durand and Crimmins in 1988 and is still used today. So it's a rating scale to make a determination as to what may be causing a behavior or what the reason is that the behavior, what function the behavior may serve. So for example, there are 16 questions. And once again, we got a Likert scale here. So 0 would indicate that the behavior never occurs for that particular reason, which I'll show you in a minute, or 1 almost never occurs, or 2 seldom occurs, 3 half the time, 4 usually, 5 almost always, and then 6 always. So as a result of familiarizing yourself with that Likert scale, a series of questions are asked. So, for example, question number 1, would the behavior occur continuously if this person was left alone for long periods of time? So, by way of example, one case that I've been involved with recently has to do with a young 15-year-old girl with severe self-injurious behavior. And when I asked the mom that question, would that behavior occur, head hitting, if your daughter was left alone for long periods of time, her answer was almost always, 6. So what that suggests, if we go back to the causes of behavior and the review that we did, what that suggests is that there may be automatic reinforcement going on here. So she's left alone, so there's nothing socially mediated, and the behavior would occur for long periods of time if left alone. So the consequences are automatic in nature. So this is what we're trying to get at through the motivation assessment scale. We're trying to get a sense of what category the behavior falls in terms of possible cause and possible function. So let's look at the second question. Does a behavior occur following a request to perform a difficult task? Okay, if the answer is yes, if it's always, more specifically, if we rate it a 6 again, then what that would tell us is that that individual may be escape motivated, or they may be trying to avoid demands. So the demand could be removed, for example, by an individual. So that would be socially mediated negative reinforcement. So the person engages in a behavior for the purpose of something uncomfortable being removed. What's uncomfortable? The demand. Or something aversive being removed. What's aversive? The demand. Why do they do it? Because if they engage in the behavior, the individual takes something away. What do they take away? The demand. So what happens to the behavior? They do more of it. They accelerate in nature. So this person, if the answer is 6 always, may be motivated by escape or avoidance. So as a result of going through this entire motivation assessment scale, and as a result of answering all 16 questions on the motivation assessment scale, we will get a really good sense in terms of what function the behavior may be serving. And at the end of the motivation assessment scale, you're able to calculate whether their behaviors in terms of their apparent motivation fell into the category of automatic reinforcement, sensory motivated, or escape motivated, or attention motivated, or tangible motivated. And then as a result of totaling and calculating a mean and a relative ranking, we can get a really good sense in terms of why the behavior may be occurring. So the motivation assessment scale is a scale that's often used by a board-certified behavioral analyst for the purpose of making a determination as to hypothesized causes of behavior. And I underscore the word hypothesized here because we have not done systematic manipulations. We have not done direct testing. So the best we can do here is to hypothesize why something may be occurring. A similar tool is what's referred to as the functional analysis screening tool, also known as the FAST, and that was developed by Dr. Brian Iwata, who I introduced earlier today, and that was done in 1995. Another tool, one that I find extremely helpful, is what's referred to as the Setting Events Checklist by Gardner and Cole, and that was developed in 1990. So essentially, with this tool, we're looking at setting events, for example, that may give rise as an antecedent to behavior. So, for example, environment and routines. Was the routine altered? Was there a change in activity? And did that occur the same day, for example, or even the day before? So it could be proximate setting events, or what's referred to as distal setting events, if it's far removed from the actual occurrence of a behavior. So was a routine disrupted? Was there a change in the caregiver or a teacher? So here, for example, it could be a substitute teacher that came in, and maybe the substitute teacher gave rise to a lot of aberrant behavior. So the setting event checklist allows us to begin detecting or identifying the environmental factors that resulted in the demonstration of problem behavior. So one of the things that I like about this checklist is that it reviews environmental considerations. So things could be crowded. Anybody here, for example, going through the Registered Behavior Technician series, if you're the kind of person that goes into an elevator and the proximity of other people is just way too close, if there's just too many people in that elevator, and you begin engaging in some kind of behavior, could be nail picking, for example, or could be cuticle picking or lip biting, for example, all as a result of crowded conditions, then we could say one of the setting events that may give rise to your nail picking or cuticle picking or lip biting could be crowded conditions or close proximity with other people. Or perhaps a barren environment, an impoverished environment can give rise to problem behavior, or noise level, or the temperature in a room, whether it be too hot or too cold. Also the time of day may be a variable that's associated with high rate behavior, or it could be the presence or absence of music, or the physical layout of an environment. You get the idea. There are a number of environmental circumstances that could be correlated with behavior. And there could be social circumstances. It could be a major life change for an individual. It could be the separation of a mom and dad. It could be divorce that occurs. It could be an individual who has just moved from their home that they lived in for a good part of their lives to a new home. It could be an altercation or a fight with a peer that was a precursor to a problem. So there are environmental considerations, there are social considerations, and also there are physiological considerations. Not enough movement and exercise, or sleep disturbances. So there could be problems with a disruption in the sleep-awake cycle, or the person could have dental pain, or they could have allergies, or they could have infection, or perhaps they don't have a healthy bowel and bladder regimen, and there may be constipation as a result of a dysregulated bowel regimen. Or it could be an individual, for example, who does not receive adequate food from their family's home. They may come into school without having eaten breakfast, or having eaten dinner the night before, or breakfast the morning of. So there could be hunger issues or thirst issues. Or there could be physiological events such as hyperthyroidism or hypothyroidism. All these things will play a role in terms of a person's behavioral presentation. So the value of this kind of checklist, the setting event checklist, is that it systematically, methodically requires you to think through all the factors and variables that may be at play and may be giving rise to problem behavior. So these items here, they fall into the category of indirect assessment, and they take the form of rating scales and checklists. And there's a number of fine examples out there, the motivation assessment scale being one of them, Dr. Iwata's FAST, functional analysis screening tool, the setting events checklist, which I just showed you. And then there's another checklist. It's called Questions About Behavioral Function by Mattson and Valmer, published in 1995. And because there's such a variety of tools, this is one of the reasons I keep emphasizing to you that it'd be important for you to touch base with your board-certified behavior analyst supervisor to ensure that you have a good understanding of the tool that they use and that they prefer to use for the purpose of their own functional behavior assessment process. Okay, so far we've got the indirect process, the indirect assessment involving interviews. It also involves rating scales and checklists. Now, that is one way of going about the process of conducting an FBA. We can get hypothesized function of behavior or hypothesized causes as a result of going through that process. If we want to supplement that process by doing direct observation, we certainly have that option as well. And it's suggested that, that this occurs because there's nothing better than being direct and in terms of witnessing the behavior, seeing the behavior, and considering environmental factors as a result of your direct observation. That's different from just interviewing individuals or completing a checklist. So this pushes us along the continuum in terms of rigor and frankly, level of precision as well. So now we've moved from doing a checklist or doing an interview to directly observing the individual in the context in which the behavior is occurring. And that is one of the things I do want to emphasize, is that it is the responsibility of the board certified behavior analyst and that person's responsibility to advise you and to guide you to go where the behavior is occurring. So if it's occurring on the school bus, that's where you observe. It's occurring in the early morning hours and in a person's home, then that's the time of day that you get there, the early morning, in the context of the person's home, and you observe in that venue. Or if it's occurring in a classroom in a school, for example, then the observation should occur there. So while you're doing the observation, you can be collecting. You've heard this before. What's referred to as ABC data, antecedent behavior consequence. You're making notations in terms of what occurred just before the behavior. You're being very clear in terms of what behavior it is that you're tracking, and then you're listing the consequences that that may have followed. And you're doing the note taking, you're doing the recording, or you're using a more structured ABC tool, which I've shown you in one of the previous modules. So that does involve direct observation. You're doing the ABC recording. You're actually in the environment and you're recording the antecedents and the behaviors and the consequences. Or you're doing a scatter plot analysis of behavior. And once again, here's a good example of a scatter plot. One of the reasons I really want to bring this particular scatter plot to your attention is because this scatter plot is tracking both appropriate responses and over on the left-hand side, and inappropriate responses. So you can see here that the board certified behavior analyst that's using this functional assessment scatter plot is as interested in adaptive behavior, appropriate forms of behavior, as they are in the maladaptive behavior. And I salute the person that does this because we want to know as much about habilitative behavior, adaptive behavior, healthy behavior, and good functional behavior from a social standpoint. We need to know as much as we can about that. So by way of example, the person completing the scatter plot would complete the activity that the person was engaged in, and then begin recording whether there was peer interactions, and we see that there were 3 occasions of peer interactions. Then we also indicate that in the alone condition, there was also appropriate behavior. What kind of appropriate behavior? Could be appropriate play. You know, the person may have been alone, but they were engaged. They were doing things that were socially appropriate, and that's desired. Or it could be a parallel play situation. And here again, you know, the person's engaged in a very appropriate way, and we want to know as much about that as we do about the maladaptive behavior. So on this scatter plot, we've got one occasion where during a peer interaction, or it involved a peer interaction, and there was a problem behavior. The individual plucks a football from a little girl's hands. So the little girl's named Marcia. Plucked it from her hands, and what was the consequence of that? Well, he got to play catch with Rye as a result of having taken the ball. So this little guy here is tangibly motivated, isn't he? So he takes the ball from Marcia. Actually, I'm noticing here that the student is Trish. So she takes the ball from Marcia and then plays with Ray. So one of the things that we learned from this kind of observation is that the person may be motivated by tangibles in the environment. Here's yet another example of a scatter plot. And here we have the activities listed. So we have math and science and social studies and English, lunchtime, physical education, art class. The information from a scatter plot standpoint pops right out, doesn't it? Okay, let's look at things that are going well. Lunchtime is good. Health and physical education is good. Art class is great. And then the hours between 12:30 and 2:40 are non-problematic. So the value of the scatter plot here is that it allows us to isolate where the difficulties are. And I don't know about you, but I'm looking at math. And math class is a problem, especially on Tuesdays and Wednesdays. You can see the frequency of the problem behavior, disrupting class and making inappropriate comments and verbal threats occurs on 11 times on Tuesday between 9:20 and 10:10, and another 8 times on Wednesday between 9:20 and 10:10. So from an intervention standpoint, math class is what needs to be focused on. What about the math class? Well, I mean, there could be any number of factors that are occurring. It could be the curriculum. It could be the level of difficulty of the assignment. It could be that this individual has a skill deficit with respect to math, or a performance deficit with respect to math, or there could be other variables. We don't know yet, but this is an example of a scatter plot, and you can see how the information just pops out. That lunchtime is not an issue. Health and physical education is not an issue. Art class is not an issue. Math class is a major problem. And then science to a far lesser extent. And then a single instance in social studies. But for a board-certified behavior analyst and for you, you're looking at this information and making a determination as to what may be going on and designing your interventions accordingly. Now, the final form of assessment is an actual analysis. And this is what's referred to as an experimental analysis of behavior. And this is done in an analog situation, a simulated situation, or in situ, meaning in the actual environment. The functional analysis, the experimental manipulations occur if the function of a behavior cannot be hypothesized as a result of the indirect assessment or the direct observation, and it's also used if the severity of the behavior does not put anyone at risk. So it becomes very complicated to do a functional analysis if the person is extremely aggressive and there's a high likelihood of risk in terms of injury to other people as a result of doing a functional analysis, or maybe the person has a repertoire of self-injurious behavior, and there may be a high level of risk to the individual as a result of doing a functional analysis. However, if the board-certified behavior analyst, and this must be conducted by a BCBA, if they make the determination in the context of the team and with consent from the family that systematic manipulations should be done, then that BCBA will map out the plan for doing a functional analysis, and they will review 4 conditions to make a determination as to what may be occurring in terms of the problem behavior. So one of the conditions is that they will put the person in what's referred to as a lone condition, and they'll be trying to make a determination The alone condition will be conducted to make a determination as to whether the behavior may be automatically reinforcing, not socially mediated. The second condition is what's referred to as an attention condition. That means that once the problem behavior occurs, the person will deliberately receive attention as a result. The reason that that is done is to make a determination as to whether the behavior accelerates, increases in likelihood as a result of the attention. And if that's the case, the behavior accelerates as a result of attention, then perhaps we can say the behavior is attention seeking. So that'd be socially mediated positive reinforcement, right? So socially mediated because it does involve another individual, positive reinforcement because something is added. The third condition is what's referred to as the demand condition. Under these circumstances, a demand is deliberately removed following a problem behavior. What is the expectation? the expectation is the behavior accelerates if they're motivated by escape or avoidance. Why? Because if the person engages in a problem, then somebody takes something away, something uncomfortable, something aversive. So this would be socially mediated negative reinforcement. I engage in a behavior, and as a result of doing that, somebody takes something away. What do they take away? Something I don't like, something uncomfortable, something that's aversive to me. Am I going to do more of that behavior? The answer is yes, if I'm motivated by escape or if I'm motivated by avoiding things. The final condition is a control condition. It's referred to as the play condition. And this is where the person has engagement because we're trying to rule out that variable and that factor from the analysis. So 4 conditions: the alone condition, attention condition, demand condition, and play condition. This is the base level of a functional analysis. This involves systematic manipulations, and this involves arranging consequences and arranging them in such a way that allows us to make a determination as to whether the behavior is occurring for these various reasons: for socially mediated positive reinforcement, socially mediated negative reinforcement, or for automatic reinforcement. That's what we're trying to determine in the functional analysis process. Now, one of the things I want to do once again is to give credit to individuals who I think have made major contributions. One such individual is Diana Browning Wright. She's from Positive Environment Network of Trainers, also referred to as PENT, out of the California Department of Education Diagnostic Center in Southern California. The reason I have so much respect for her work is because she created what's referred to as a clinical mapping process. And this is what allows individuals to move from the functional behavior assessment process to actual clinical intervention. And she's created a map for actually doing that. So this is the process that is so important, that once the interdisciplinary team has conducted their indirect assessment and or the direct observation and or their experimental manipulations, they have then gathered a lot of relevant information for the purpose of creating a behavior intervention plan. And somebody on the team has to be the decision maker in terms of the development of the functional, synthesizing the results of the functional behavior assessment and actually constructing the behavior intervention plan. So that decision maker has to be an individual that walks the team through a very deliberate and methodical process for arriving at the best interventions for the individual. And Diana Browning Wright has done a magnificent job in terms of mapping that process for individuals. And she encourages us to look at 3 guiding principles. One is just reminding us that problem behavior is related to context. So as a result of the FBA process, we have to search for the environmental events and the environmental things that may be giving rise to problem behavior. We also need to assess the general conditions, the assigned activities, the curricular expectations, seating arrangements, physiological states. This is why I reviewed with you the setting events checklist, because in order to get at that information, we have to have a pretty methodical way of uncovering it. So that will have implications. If the curriculum is too difficult for the individual, then part of our behavior intervention plan may be to align that person with an appropriate level of curricular activities. That could be one implication. So we're looking at problem behavior. We're looking at the context in which it's occurring, and our behavior intervention plan will integrate that knowledge. We also know that behavior serves a function. The implication here is that behavior, both adaptive and maladaptive, results in either in agreeable outcomes. When they result in agreeable outcomes, then the person will do more of it. So we need to be mindful that behavior serves a function, and that there's a reason why it occurs, and that a good behavior intervention plan is one that is going to be addressing the function of the behavior. We need to be looking at the triggers for high likelihood problem behavior, and we also need to be looking for triggers for adaptive behavior, and then developing our behavior intervention plan accordingly. The next thing that we need to do in developing the behavior intervention plan is to address the environmental factors and the function of the behavior. And the implication here is that we need to change environmental conditions. We need to teach adaptive and alternative and acceptable forms of replacement behavior. That's what's referred to as functionally equivalent replacement behavior. We need to address the environmental things that may be giving rise to a problem, such as noise levels or temperature. Perhaps the environment is understimulating or overstimulating. Perhaps there could be frequent disruptions in the environment. All of these environmental factors must be addressed. We cannot just organize or arrange consequences for behavior and turn a blind eye toward the environment. We must be doing things on a simultaneous track, teaching functionally equivalent replacement behavior, adjusting the environment so that the antecedents are no longer present, and arranging for different consequences when problem behavior occurs. So we're evaluating the environmental predictors and integrating that into our plan as well. And other environmental predictors could be a lack of choice making, unpredictable schedules, or abrupt transitions, for example, or activities or a curriculum that's just much too difficult for an individual. So a good behavior intervention plan is one that will address all of these factors and be developed accordingly. What you have in front of you here is an actual format for a behavior intervention plan. So you'll notice that the sources of the information are delineated. So the individual completing the plan will indicate how they did the FBA, whether it was direct observation or an interview or systematic manipulations. This behavior support plan also lists the individual's strengths, positive relationships, interests that they have, what kinds of things function as preferences or reinforcers. This is a nice linkage to previous modules where we talked about strength-based assessment. We also talked about reinforcer assessment. Then this behavior support plan will also outline the function of behavior. It'll give it'll make a statement in terms of hypothesized function if you only did an interview or a direct observation. You could make more definitive statements if you actually did a functional analysis. But this support plan is asking you for information regarding function and why the behavior is occurring. Then it requires us to list the setting event strategies, the antecedent control strategies, and the teaching strategies that we'll be using in order to give rise to alternative behaviors of functionally equivalent replacement behaviors, and then reinforcement strategies for appropriate forms of behavior. This plan will also require us to outline what our crisis intervention strategy is, and then how we'll go about evaluating the success of the plan, who's responsible for monitoring. That would be you, actually, as a registered behavior technician. What the criterion is for success, the person responsible for evaluating success or the need for change. Then the plan also requires us to make comments as to whether it contextually fits. That is, the arrangements that we made, the consequences and the interventions, whether they match contextually the environment in which we're working with the individual. And then we're required to communicate with stakeholders. Who will be the person that will be contacted as a result of our information about the efficacy of the plan, how that person will be contacted, when they'll be contacted, the date and the frequency of contact. So this is a great example of a behavior intervention plan format that I wanted to bring to your attention. And finally, I want to review some recommendations by a group of authors, Mayer, Salter, Asaroff, and Wallace. There are 5 steps to lasting behavioral change, and I think they're excellent recommendations. The first one is to know the person that you're supporting and know the context in which you're supporting the individual. And most of all, build rapport. Deliberately build rapport with the individual, and to seek out guidance from your board-certified behavior analyst in terms of how you go about this process of building rapport. And that could be through the use of non-contingent reinforcement. It could be by not imposing any kind of demands on the individual, just strictly establishing yourself as a conditioned reinforcer for the person. But your board-certified behavior analyst supervisor will certainly give you directions in terms of how to build rapport. The next recommendation is to know your environment and your support team, and know that there's school psychologists behind you if you work in a school. For a person whose behavior may be linked to hearing difficulties, for example, there may be an audiologist behind the scenes. One of the things I've mentioned before is that I've done a lot of work at Perkins School for the Blind, and this is something that I relied on tremendously in that context, is the results of an audiologist and the recommendations from an audiologist. It may be also the case that the person requires assistive technology for the purpose of communication. So a person that's an expert in assistive technology, it could be a speech and language pathologist, for example, will certainly give you guidance in terms of whether you can use, no-tech devices, low-tech devices, high-tech devices, and which devices are most appropriate for the person. The next recommendation is to identify treatment options. So you're building functionally equivalent replacement behavior. So what that means is that if a person's aberrant behavior occurs for a particular reason, you want to build an adaptive behavior, a socially acceptable behavior that results in the same outcome. So a big focus is going to be on doing just that, building functionally equivalent replacement behaviors. Once again, we're always using evidence-based practices, so anything that your board-certified behavioral analyst asks you to do will be a practice that has been demonstrated to be effective with the population that you're working with. Ensure that your resources are available. Do not, for example, design a plan where there's a dearth of resources, or you just don't have the materials to use to support the implementation of a behavior intervention plan. Ensure that there's a goodness of fit between the person's developmental level, the context in which you're working with, and one of the things that's really important to me is maintaining the aesthetics of the behavioral arrangements. One of the contributions that I really admire is by Phil Heinlein, and he wrote a great article on the aesthetics of behavioral arrangements. And this is a quote from him that I think is just perfectly appropriate. And that is this: the attractiveness and acceptability of an arrangement are just as integral to that arrangement as are the results it can produce. So the aesthetics, what an intervention looks like, whether it confers dignity on the individual, whether it looks attractive and appealing is critically important. We do not want to do things that are stigmatizing to an individual or unattractive, and the aesthetics is something that we should maintain a high appreciation for. The next recommendation is to collaborate. Involve families. Seek input from moms and dads, aunts and uncles and siblings. Engage teachers in terms of their recommendations. Gather input from other professionals from other disciplines and stakeholders in general. The other thing that's important is that the stakeholders value the outcomes that you're achieving. And this makes a nice linkage to the behavioral cusp information that we've discussed throughout this module. And then finally, training. Your training is essential. So the training that you receive on the functional behavior assessment process, on the behavior intervention plans, must be performance-based. You must demonstrate performance and capability of actually executing each dimension and each component of the plan. You should have a criterion level of performance that you need to achieve, perhaps from a written standpoint or from an oral quiz or from a performance demonstration standpoint. You must receive verbal instructions in the context of lecture or description and explanation from your board-certified behavior analyst. Perhaps you'll get video recorded instructions. That's always helpful as well. Role-playing plays an important role in terms of training, and then in vivo instruction, meaning actually being there in the context of the actual environment in which you'll be implementing the interventions is very helpful as well. So finally, with respect to the questions for our module, they are as follows. Who is the first person to use the word functional and refer to causes of behavior? Of course, that was B.F. Skinner. Who developed the first operant methodology to assess the functional relationships between self-injurious behavior and specific environmental events? That would be Dr. Brian Iwata and colleagues, Iwata, Dorsey, Silfer, Bauman, and Richmond. What is a functional assessment? Well, it's a set of procedures used to identify functional relationships between challenging behavior and specific environmental events. What is socially mediated reinforcement? It's reinforcement that's dependent on other people and involves interaction with and the mediation of other people. Name the 3 assessment methods we reviewed. Well, indirect assessment, direct assessment, or descriptive, and experimental analysis, or deliberate experimental manipulations. And that concludes this module on functional behavior assessment. Thank you.